So it's my pleasure to introduce Mark Wilson. Mark has been a friend and a colleague for more than 20 years. We worked together at Cooper Green for a number of years, practiced medicine in the clinics, practiced on the inpatient services. And one of the things that I got to know about Mark is that he's the kind of guy that is deeply, deeply passionate about the people he serves and the communities that he lives in. And he's also the kind of guy that never says no. He was constantly asked to serve in a variety of capacities that other people may not want to do, but he was always willing to work hard at that. He's been the health officer for a couple of years and builds on a legacy of incredible health officers that Jefferson County has been blessed to have over the years. It goes back from the founding in 1917. We're indeed fortunate and lucky to have Mark as our health officer, and it's my pleasure to introduce Mark, who's going to give the 2016 annual public health address.
Thank you, Max, very much. I'm very indebted to Max Michael. He's the guy who first hired me when I came to Birmingham in 1991. So thanks for the job, Max. I also am fond of saying to people, Max is the guy who's gotten me into all the trouble I'm in now. So I think that's pretty true. So in the past, there's been somewhat of a loose tradition of the health officer giving an annual State of the County's Health address. I'm taking the liberty to change that just a little bit, and rather than calling it a State of the County's Health address, calling it just a public health address, to give us a little more flexibility in what we talk about and maybe be a little less boring. You can be the judge of that by the end of the day. But I don't want to feel compelled every year to give a litany of statistics about where we are. Some of those statistics don't change that much from year to year, but I also want the flexibility to talk a little bit out of the box. And today that's what we're going to do. I'm not going to give you very many health statistics. If that's what you came for, sorry to disappoint you. But what we are going to talk about is very important. And in keeping a little bit more with this year's, the lights, come on. This year's national theme. So for National Public Health Week, as you've already heard, this year's theme is Healthiest Nation 2030. Basically, the idea is, how do we as a nation become the healthiest nation in the world by the end of the next generation? The United States is number one in a lot of things. We're number one in medical technology, medical research, and we have some of the best medical care in the world. And we are also number one in healthcare expenditures. So one would think that we would also lead the world in health outcomes. But on very important indicators such as life expectancy, birth outcomes, we are not number one. We're not even in the top 25. So there's a real disconnect there. I've sometimes called it the public health paradox. Of course, among the states, Alabama is often listed near the bottom. I'm sure many of us are kind of tired of hearing that. And then here in Jefferson County, where we do have some of the very best medical care in the world, we still are not number one in Alabama. We have a lot of struggles here. So the question is, what would it take to get us back to number one in one generation? For National Public Health Week, which kicks off today, we're asked by the National Association, or the Association of Public Health nationwide, to consider looking at 8 different things that we as a nation need to look at and address in order to be healthy. Don't worry, I'm not going to go through all 8 in detail. Of course, there are many things we as individuals must do. There's a lot of personal responsibility involved in health. We all need to eat our 5 servings of fruits and vegetables every day. We all need to exercise at least a half hour brisk exercise 5 times a week. As has already been mentioned in the proclamation, we need to get our preventive medicine taken care of. We need to make sure we're vaccinated, etc. But as a community, we have a lot that we need to do to build a healthier community that makes it more conducive for people to do the things that they ought to do. The conditions that exist where we spend most of our time, in schools, at the workplace, in the neighborhoods where we live. These are the places where we need to build a healthier community. And this is why we all share a responsibility, not just for our own personal health, but for building a healthier community together. These are not just pie-in-the-sky ideals that sound good. The things I'm going to mention are all based in public health research, and there's an evidence base for these things. So here they are, the 8 things. Number 1, maintain and strengthen the public health infrastructure and capacity. Number 2, help all people graduate from high school. Number 3, provide increased economic mobility, namely help people have a way to rise out of poverty. Number 4, further promote justice and equal opportunity for all people. Number 5, give people a choice of healthy foods. Number 6, promote a healthy environment and prepare for the health effects of climate change. Number 7, build safer, healthier neighborhoods. And finally, number 8, provide access to quality health care for everyone. Now, if you think about that list, if you're paying attention, you'll notice that many of these things are not in areas that we would automatically associate with public health or the health care delivery system. But based on public health research, things like high school graduation rates and economic mobility are in fact leading predictors of health. So as I mentioned, I'm not going to elaborate on all 8 of these today, but I do want to focus on just a couple of them. And I want to focus not just at the national level, but bring it close to home. Focus to what's going on in our local community, Jefferson County and the Birmingham area. How do we, and I emphasize the word we, build a healthier community? What are areas where it's actually in our grasp to make a meaningful difference? You know, you say get everybody out of poverty. A lot of people say, well, we don't, that's going to be a really tough one to do. So there's some other things I think that we can actually do if we really determine to do it. Before I do that, though, I do want to touch on our public health infrastructure, especially on this occasion where we are talking about Public Health Week and our local health department. We mustn't take for granted the work that our public health professionals do day in and day out, often behind the scenes, to prevent disease, assure access to quality health care, promote healthy lifestyles and a healthy environment, and protect against public health threats. Our people are busy working behind the scenes to make sure the food you eat is safe, that community vaccine rates are high, that tuberculosis, sexually transmitted diseases, and other communicable diseases are detected and controlled to prevent outbreaks. They promote breastfeeding and access to healthy nutrition for vulnerable mothers, infants, and young children. They make sure animal bites are investigated to prevent rabies. They monitor children's lead levels and intervene when they're elevated. They help protect our environment and enforce the Clean Air Act for Jefferson County. They educate the population on the importance of avoiding tobacco and the importance of having strong smoke-free policies. They provide primary health care and dental care for uninsured and underinsured populations in Jefferson County. This is only a partial list of what folks at our health department do, but I just want to remind everyone of the important work they do. A fair amount of that work is to maintain the significant gains we've had in public health during the 99 years that we've been in existence as a health department. And some of it is to improve the health of the population. As a health department and a public health system, we also have to maintain the capacity to handle new challenges, such as emergency preparedness for natural and man-made disasters. The recent Ebola epidemic, which surprised everyone, where we had to monitor travelers coming into our local community from West Africa. The drug addiction and overdose epidemic that's sideswiped us in the last few years, where we've been instrumental in helping people get access to the antidote for heroin overdoses. And preparing for the potential of a local Zika virus outbreak where there's a great deal of unpredictability, but where we need to make sure we're prepared. In November, the Jefferson County Department of Health became one of 96 health departments in the United States to get national accreditation through the Public Health Accreditation Board. That's 96 out of over 2,000 local, tribal, state, and territorial health departments in the United States. I'm extremely proud of many staff at our health department who worked very hard to achieve this status. The accreditation process measures our health department against performance standards that are nationally recognized, practice-focused and evidence-based standards, and it helps keep us on course on a continuous performance improvement process for the future. This helps ensure that our health department is being the very best that it can be for the benefit of the people in this county. So please hug a health department worker sometime this week, or at least say thank you. Now I'm going to go on to focus on just two other areas from that list of 8 that I gave you earlier: education and building healthy neighborhoods. First, education. The stated goal in the National Public Health Week is to help all young people graduate from high school. Of course, the graduation rate as a number could be a meaningless number if we're not careful, so we must focus on more than just this. I really like the more comprehensive approach that the Bold Goals Coalition for Education has taken, sponsored by the United Way of Central Alabama. They've included the high school graduation rate in their goals, but they're going deeper than that. Their goals include, number 1, every student enters kindergarten prepared. Number 2, students meet certain academic benchmarks between kindergarten and high school graduation. And every student who does graduate from high school either enrolls in post-secondary school or enters a career upon graduation from high school. I should mention here that there are multiple other organizations in our community, such as Child Care Resources, the Birmingham Education Foundation, Better Basics, the Junior League of Birmingham, to name only a few, and several faith-based groups and many individuals who are working tirelessly to help our children succeed educationally. Lack of high-quality education is a root cause of poverty and injustice, and a strong predictor of poor health. Children born into a family in multi-generational poverty are unlikely to break out of the cycle of poverty as adults, especially if their parents are also of low educational attainment. Injustice exists inasmuch as children's race and geographic location predict their likelihood of acquiring a good education. The trajectory for children begins early and goes far. Modifiable factors in the prenatal period and first years of life have a lasting impact on the brain development and emotional health of a child. These in turn impact a child's ability to thrive in a pre-K or kindergarten program. Children who are not acclimated to the classroom and ready to learn as they enter kindergarten or elementary school are less likely to be reading at grade level 3 years later. If children are not reading proficiently by the end of third grade, they are 3 or 4 times as likely to not graduate from high school than children who are. If children do not graduate from high school, they are more likely to be unemployed, to live in poverty as adults, even if working, to be incarcerated, to be unhealthy, to die prematurely, and to have children before they're ready to support them, thus perpetuating a cycle of poverty and poor health. Preschool education and other childhood development interventions help ensure school readiness so children are more likely to be performing at grade level when they reach the end of the third grade. Early childhood development programs and preschool, if done well, are a good return on investment. An example of one such program that helped give us a lot of the evidence base we have with long-term follow-up of participants is the Abecedarian project, first developed in North Carolina in the 1970s. Interventions even earlier in life, even before birth, include home visitation programs for high-risk pregnant women and infants. These have been shown to reduce infant mortality, a huge challenge in our county, and produce a high return on investment with several long-term benefits. They typically start during pregnancy and continue until age 2 or 3. Successful evidence-based examples include Parents as Teachers program and the Nurse-Family Partnership. These all recognize that the parent is the primary caregiver and teacher and seek to educate and support the parent in this role. So there are 2 ambitious but specific and achievable goals I would challenge us as a community to achieve that could really impact health for children. Number 1, establish a nurse-family partnership program in Jefferson County and gradually expand it and complement it with other evidence-based programs with the ultimate goal of making every first-time mother living in poverty or otherwise at high risk able to access this service. The return on investment is very strong, not just for the mother and child, but for all of us. This is something that I, as health officer, am committed to facilitating, and we've already had several discussions with the Community Foundation of Greater Birmingham and other interested parties in how to get this started here and how to make it sustainable. The second challenge is to achieve access to pre-K education for 100% of preschool-age children in Jefferson County. The number of pre-K classes available is small but expanding, and the 100% target is already a stated goal, but it would serve us all well if we could accelerate that expansion. So the second thing I want to focus on is to build safer, healthier neighborhoods. Downtown Birmingham, as we can all see, is really booming, and this should have a health-promoting effect. For the overall metropolitan area to be successful, a city center will need to be successful. It's extremely encouraging to see the success of places like Railroad Park and Regents Field, with so many people coming out and mingling and getting exercise and getting connected, and the amazing growth of housing and businesses around that area. There's also talk of building upon the Innovation Depot concept and building upon the strength of UAB's research engine to build Birmingham's economy with a much more robust innovation district. This was emphasized by Bruce Katz of the Brookings Institution, an author of the Metropolitan Revolution, when he visited Birmingham a few months ago, thanks to UAB School of Public Health and Leadership Birmingham inviting him. If we're successful in doing that, this will benefit the health of the whole region. But at the same time, we must be very intentional to focus increased attention on struggling neighborhoods and smaller municipalities in Jefferson County where conditions are not so vibrant and not so healthy. As some neighborhoods do begin to show some signs of revitalization, we need to think very carefully about how to enable the people that live in those communities to stay there and rise up with those communities rather than being displaced by gentrification. There are some great initiatives underway to help build safer, healthier neighborhoods. City planning, such as the Regional Planning Commission, Birmingham City Planners, and others, and public health are at the same table having more and more conversations about ways to make the built environment more conducive to health. And more planners are incorporating health considerations into their plans. As one recent example, working through the Jefferson County Health Action Partnership, currently led by the United Way, the City of Birmingham planners agreed to use a health equity index as a factor in prioritizing projects for street improvements and repairs and sidewalks. This index incorporates the poverty level, life expectancy, and the infant mortality rate for those census tracts. In a small way, this is a step forward towards using health considerations and health equity in all that we do. So I'd like to highlight two plans that I think we as a community should all rally around. Number one, the City of Birmingham's RISE initiative and the Birmingham Land Bank Authority. They're just getting underway, but they're providing great promise to help clean up the neighborhoods of thousands of blighted, tax delinquent properties and help to strengthen and revitalize those neighborhoods. RISE is an acronym that stands for Remove Blight, Increase Values, that's property values, Strengthen Neighborhoods, and Empower Residents. Dilapidated houses will be demolished, and in some cases, next door neighbors will have the opportunity to acquire that property at little or no cost through the side lot program. And legal assistance is pledged to be provided for estate planning so that existing families can preserve the strengthened assets they have for the future. This is an extremely ambitious project. It's been estimated it would cost over $70 million to implement it and clean up over 16,000 properties that have been identified. But it can be done if we as a community are committed to it. And it could reap great benefits and contribute to the overall health of these neighborhoods and the people that live in them. I should mention here that Rev Birmingham is doing what Rev Birmingham is doing, seeking creative ways to promote business development in our neighborhoods. This is also a very critical component to the overall success of our communities. And I should mention the YMCA, which now has a very strong outreach to neighborhoods in need. Again, there are many others doing great work that I don't have time to mention here. The second plan that I would like to urge us towards completion is the Red Rock Ridge and Valley Trail system. The master plan was unveiled in 2012 with grant funding from the CDC and input from over 3,000 Jefferson County residents. The plan calls for 250 miles of greenways and off-street trails and 500 miles of street connectors friendly to bicycles and pedestrians. The original goal was to complete 50 miles of greenways in the first 5 years, and it looks like we may be on track to exceed that goal. We have a long way to go. But if all the different municipalities and private sector partner together, we can get this completed. It's a big commitment of resources. But again, there's a good return on investment. There is evidence from other communities that will reap economic, environmental, social, mental health and physical health benefits, including healthcare cost savings, if we do this. Our health department has already invested heavily in the trail system, and we will continue to partner with the Freshwater Land Trust and others to facilitate the completion and utilization of the Red Rock Trail system. So the things I've mentioned here are a very ambitious to-do list. Some may ask, why am I, as a medical doctor in public health, speaking about things like early childhood education and cleaning up neighborhood blight? Aren't these out of my lane? Yes, in a way they are, certainly in terms of my expertise or lack thereof. And I don't want anyone leaving here thinking that I was pretending to be an expert in education or city planning. But the point is that those of us who work in public health and in health care cannot create a healthy community alone. It cannot be done without addressing these other conditions, things we call social and environmental determinants of health. The point is that we all have to work together, all sectors of the community, public health, government, education, higher education, the business community, churches, nonprofits. We must work together to build a healthier community. I've mentioned some ambitious goals that require big investments, but the rising cost of healthcare and the cost we all bear of having an unhealthy population is arguably one of the greatest threats to our society, at a national level and at a local level. Our society has achieved great things in the past when faced with a major threat. Some would doubt whether we can come together and achieve something great today, especially when politics are so extremely polarized. But I actually have hope, at least for us at a local level, for our ability to do some of the things I've mentioned specifically today. Because I think that many of them lend themselves to bipartisan support. If we come together and make these things a priority, we can make great strides towards achieving them. Thank you.